Portions of this program are supported in part by funding from the New York State Pollution Prevention Institute through a grant from the New York State Department of Environmental Conservation. Any opinions, findings, conclusions, or recommendations expressed are those of the presenters and do not necessarily reflect the views of the New York State Pollution Prevention Institute or the Department of Environmental Conservation.
Welcome, and thank you for this opportunity to present the ChildSafe School, which is a program of Grassroots environmental education. I'm Patti Wood, the Executive Director of Grassroots, and we have created this program to protect children in their school environment. Grassroots is a widely respected science-based environmental health organization. We were founded in 2000. Our mission is to inform the public about the links between common environmental exposures and to empower individuals to act as catalysts for change in their own communities. A lot of our programs focus on children, and the ChildSafe School is no exception. There is a growing body of evidence linking environmental exposures to impacts on children's health, and children's illnesses and disabilities have been growing in incidence over the past several decades. Early childhood through adolescence are the most important developmental years. Let's look at some facts. Children are uniquely vulnerable to environmental exposures. Pound for pound, they take in more contaminants than an adult. They drink more water, they breathe more air, and they take in more of those contaminants that may be found in their environment. And then children also have natural behaviors that put them at risk as well. They typically have the hand-to-mouth behavior, and children learn about their environment by using their senses. They are always taking things and putting things up here to smell them and taste them and feel them. So children live in their environments very differently from adults. They also have immature systems. Their immune systems, their detoxification systems, and elimination systems are not fully developed, and so they are less able to break down or excrete toxins. They are also going through rapid growth and development, which means a lot of rapid cell division, which puts them at risk as well. Some other facts that are interesting are that asthma rates among New York's children are at historically high levels. Right now, we are looking at about 1 in 7 children, school-aged children, who are suffering from asthma. Cancer rates in children are also trending upwards. We have had a 1% increase for the past 25 years in childhood cancers. So that's pretty alarming. That's a 25% increase in 25 years. And the number of children with developmental or behavioral disorders is also rising. Many teachers will confirm this. There are a lot of children now who are suffering from attention deficit disorders, and they're placed somewhere on that autism spectrum. These are problems that schools are managing with extra staffing and with pulling these children out during the day for special work. Obesity rates have tripled over the past 3 decades, and that also means that we are looking at higher rates of diabetes, type 2 diabetes, which is unusual, as well as cardiovascular problems. So let's look at school as a child's workplace. Children spend approximately half of their waking hours in the school environment. This number could actually be higher if they're a child of a working family where they are dropped off to have breakfast at school, and then at the end of the school day they go into a daycare setting where they will then be picked up at the end of the workday when their parents come to get them. So we have to examine the school environment very carefully to reduce or eliminate any harmful chronic low-level exposures that could put our children's health at risk. So environmental hazards in our schools, where might they be found? Well, in the classroom, we are looking mostly at the chemical toxins that are in cleaning products. On playgrounds and playing fields, we are looking at the use of pesticides. And on buses and in school bus zones, we are looking at diesel exhaust and the particulate matter that is a component of that exhaust. The ChildSafe program is based on emerging science, and this advocacy program addresses these 3 chronic low-level exposures that we just spoke about: the cleaning products, the diesel exhaust, and the turf pesticides. Let's look at them one at a time. So what are the problems that are involved with cleaning products? Well, traditional cleaning products may contain toxic chemicals, and this is because they are made from petrochemicals, and they are typically used in institutions, and they are used every single day. Unlike homes, we are cleaning our schools every 24 hours. Now, some products labeled green may not be as safe as you think. There is something called greenwashing, which we should be aware of, and that is that there is no definition of green, no legal definition of green. So you can say earth-friendly and environmentally friendly, and that doesn't really mean anything. The chemicals that are contained in those products can be the very same chemicals that are contained in petrochemical products. Children's behaviors expose them to chemical residues. As they are doing this hand-to-mouth behavior all day long, that exposes them, as well as the children who lie on their desks. Sometimes they have nap time. They actually use their desks to rest on, as well as children having snacks and being exposed that way. Children are exposed to environmental toxins 3 ways, either through inhalation, through skin absorption, or through accidental ingestion. And our children are exposed in all 3 ways. Some chemicals in cleaning products become airborne when used, especially products that are used, that are sprayed, as in the picture here, and they can be asthma triggers in children who are affected by this illness. So what are the solutions? The solutions are to use cleaning products that have little or no negative health impacts. We like to suggest the use of bio-based products. These are products that are made from elements that you would find in nature. They would be from forestry products, marine products, minerals, botanicals, or plant products. And these products are even, in some cases, made from food-grade ingredients. Of course, they have to pass the test to be able to do the job, and they have to be economically viable. And that is actually where we are right now with bio-based products. And so we are suggesting the use of bio-based products in our schools, especially in elementary schools. The other thing to do is to actually have a district policy on this, so that when you have a turnover in the administration or staffing, the school district has their policy in place. And even though there's a new person ordering product, those products would have to comply with a policy that the school district had. We have to educate and train the users of these products. It takes a little bit of time to do this, to transition from a routine to a different routine, and that's part of this. And then we encourage everyone to refer to our ChildSafe guidelines and our ChildSafe product list, which are part of this program. They are the most stringent guidelines on safe cleaning products in the nation. Diesel exhaust exposure. The problem: diesel exhaust contains more than 40 hazardous air pollutants. 21 of these are known carcinogens or suspected carcinogens, as indicated by the EPA. Diesel exhaust from idling school buses can actually enter other buses when they're lined up one after the other, when they are loading and unloading in front of the schools. Fumes from these idling buses can also be trapped under overhangs or enter the school buildings through their air intake vents, which are typically right there in the front of the school where the buses are loading and unloading. So exposure to diesel exhaust is a proven carcinogen. Primarily lung cancer and breast cancer have been associated with exposure, and it has also been proven to not only exacerbate asthmatic symptoms, but can be considered a causal agent for asthma as well. According to the EPA, there is no safe level of exposure to diesel exhaust. So the solution: we're going to turn off engines while waiting for students to load or unload. Adopt a written district policy. Once again, the ChildSafe School provides you with this policy, and you can actually, it's a sample policy, so every school district can adjust it or amend it to meet their specifics. And then inform vendors, contractors, and community of policy requirements so that everyone actually knows that when the buses arrive at the school, they are supposed to turn off their engines. And this will be easier if you have signage, not only outside the school with metal signage, but you can also have small cards on the dashboards of every bus that services your district that just reminds the bus driver to turn off the engines when they arrive at the school. Okay, the third issue that we're talking about in the ChildSafe School is turf pesticides. So children can come into very close contact with these pesticides if they have been applied to the school grounds as well as the sports fields. Pesticides will collect there. They may be very persistent on the grass for weeks, even after rainfall. And so those pesticides can actually collect on clothing, sporting gear, especially water bottles. And then kids track those pesticides indoors on the bottom of their sneakers. And most pesticides that are being used for turf today are designed to break down with sunlight, with rainfall, and with soil microbial activity. And what happens is that once they get inside a school, they break down much more slowly. So the routes of exposure, I mentioned once again, are inhalation, skin absorption, and accidental ingestion. All three of these actually could happen on a school field. Children are going through rapid growth. They have higher rates of respiration, which we talked about, and so they are in that window of vulnerability. Exposure to pesticides is linked to neurodevelopmental problems, endocrine disruption, certain cancers, as well as asthma. The solution here is to eliminate pesticides, as we have done in New York State, and then maintain the turf using scientific principles of natural turf management. And those are really quite simple. It's overseeding, aeration first, and then overseeding, the use of irrigation, and the use of fertilizers very judiciously. The benefits, basically, from having really well-maintained natural turf is that you have greater resiliency with a softer surface and less watering, easily implemented, overall cost savings. So we have recently added to our ChildSafe program some emerging environmental health issues. They are the use of artificial or synthetic turf, and the use of fragrances, and the use of wireless devices or technology in the schools. The ChildSafe School program, just overall, is a step-by-step, goal-oriented initiative to reduce or eliminate low-level toxins in school environments. Our science-based materials provide the rationale for taking action, and our advocacy tools, which are our films, our Q&As, our science abstracts, and sample policies, will help you bring about meaningful and lasting change in your child's school. The ChildSafe School program engages parents, families, communities, and school personnel in a collaborative effort. These are all the stakeholders in the school environment. And it promotes reasonable and common sense approaches to safeguard the well-being of those learning and working within the school environments. So now we're talking about not only the children, but staff as well. Overall, the ChildSafe School is based on the Precautionary Principle, which says that when an activity raises threats of harm to human health or the environment, precautionary measures should be taken, even if some cause and effect relationships are not fully established scientifically. And then we have a quote from a popular author, Michael Pollan, who says, "The problem very often is that long before the science does come in, the harm has already been done." And that's an overview of the ChildSafe School program. Thank you so much for joining me.